If you're dealing with swelling and lymphedema in your right leg, follow along with me as I guide you through a complete lymphatic massage sequence. Doing this lymphatic massage can help decrease your swelling and pain to help you walk and move better to do the things that you love. I'm Dr. Alex Hill, your physical therapist for everything oncology and lymphedema. I'm a certified lymphedema therapist and I specialize in cancer rehab. Let's get that fluid moving. Manual lymphatic drainage, or MLD, is used to help decrease the swelling from lymphedema. The goal is to move the fluid out of the swollen area and get it back into the circulation. Before you start any type of new program, including MLD, always check with your medical provider first. While you're doing MLD, if you feel shortness of breath, chest pain, dizziness, or something just doesn't feel right, stop immediately and contact your medical provider. I'm going to be showing you the sequence in a recliner chair, but if you don't have a recliner chair, you can also do it sitting in a comfortable chair or lying in bed. Regardless of where you have swelling and lymphedema, the starting point is always the same, the belly. So you're going to start with your hands at your abdomen around your belly button. You're going to breathe in through your nose, breathe out, pause, breathe out through your mouth, and as you breathe out, you're going to press into your abdomen. This pressure and breathing is going to help stimulate the central part of the lymphatic system and can be really helpful. If you have pain or you're not comfortable pressing in on your belly, that's okay, you don't need to do it. Just work on that deep breathing, okay? So you can see my belly is split into 4 quadrants, so we're going to do that breath and pressure at each of those 4 places. So we're going to start first at the right lower abdomen. Breathe in, breathe out as you press in. Moving to the right upper belly, breathe in, breathe out, a little bit of pressure. Left upper belly, breathe in and breathe out. Good, you should really feel your ribs and your belly expanding. Last place, left lower belly, breathe in and breathe out. Next place we're going to is the neck, right behind the collarbone where we have lymph nodes. You can either take one hand at a time to massage at the neck, or you can cross your hands and use both if you're able to. So right behind the collarbone, using your whole finger pads, not just the fingertips, you're going to massage and do 5 to 8 circles. If you're doing just one at a time, that's totally fine. You just want to make sure that you do both sides. After 5 to 8 times there, then we're going to move to the lymph nodes. So because the lymphatic flow is compromised in the right leg, we're going to move the fluid up to the right armpit and across to the left groin. Those lymph node areas are able to take up that fluid and help that fluid get back into the system. So you're going to take your right hand up, left hand, fingers closed. You're going to place it right into the armpit and you're going to do 5 to 8 nice slow circles. You can give a little bit of pressure here because we're working on those lymph nodes. And then after 5 to 8 times here at the armpit, you're going to then move to the left groin. You're going to take your hand, fingers flat and together. You're going to place it at that hip crease where the hip bends, and you're going to do 5 to 8 circles there. You can give again, nice firm pressure. And then the last place that we're going to massage for the lymph nodes is actually the right groin lymph nodes. So although these may be compromised if you had surgery for removing the lymph nodes or radiation therapy, you can still stimulate these lymph nodes to help get more lymphatic fluid drainage. So same thing as we did for the left groin, fingers together, place them at that groin at the right side, and you're going to do 5 to 8 circles here. Now, after we open up these lymph nodes, we get them stimulated, we're going to then start actually moving the lymph fluid. Ideally, you do this skin on skin, not over your clothes. Skin on skin is going to give you the best outcomes, but for this video, I'm doing it over my clothes. So you're going to take your left hand, fingers together, bring your right arm up, and you're going to place the whole hand at that right groin on the right side, and you're going to sweep that fluid up to the armpit. We're going to do that 5 to 8 times. You're going to move that fluid all the way up. The pressure here should be a little bit lighter. You don't want to go too firm with this. And you want to make sure that where your hand is moving, that's where that fluid goes to. So you don't want to be moving it forward into the abdomen or into the chest. That's just going to move the fluid there. So you're going to make sure you move that fluid straight up from the groin all the way to the armpit. We're going to repeat that 5 to 8 times at least. If you have some swelling in the lower abdomen, go ahead and spend some extra time here. We'll do that 2 more times, moving that fluid up from the groin all the way to the armpit. Again, skin on skin is best for this. So once we finish moving up the side of your body, we're going to then move from the right groin over to the left groin. So we're going to pump across. And again, ideally you do this over the skin, not over your clothes. That's what's going to give you the best results. And when you do this, you should feel that you're right above the pubic bone. You don't want to be coming too high on the abdomen because we're moving from the right groin to the left groin, and those hit right in the hip crease. So we'll do that 1 more time, moving it across the lower belly. So now that we've got those highways opened up, now we're going to actually start massaging the leg. When we massage the leg, we're going to massage from the top at the thigh, work our way all the way down the leg, and then move our way back up. So why we work from top to bottom is because the lymphatic fluid at the bottom can't move up the leg if that top part hasn't moved out. So think about if you're on the highway and there's traffic, you're trying to get off the highway, you can't move from way back here until all those other cars move. So that's how we go from top to bottom. So the first place that we start is going to be at the glutes. So if you're able to, you're going to shift over and you're going to massage as far back as you can from the glute and move it forward to that groin. If you're not able to move and shift your body like that, that's okay. Just reach as far as you can at your glute and bring that forward, okay? But if you can, go ahead and shift over. We're going to move that fluid from the back all the way to the front, and you're going to repeat that again at least 5 to 8 times. If you have lymphedema and you have more swelling in this area, in the glutes and in the hip area, then you can spend extra time here. That's not a problem. 5 to 8 times is just the minimum amount. All right, so we'll do that 1 more time, moving that fluid forward from the glute. Nice slow movements. So now we're going to work on the thigh. So at the thigh, we're going to start from the knee, and you're going to gently massage and move that fluid, sweep that fluid up to the groin. So you're going to do that 5 to 8 times. And if you do have extra swelling at your thigh, you can certainly pause this video, spend extra time there. That 5 to 8 times, again, is just the minimum amount of time that you need to spend to get that fluid starting to move up and out of that leg. And if you have fibrosis in your leg or thickened, firm tissue, besides just doing this lighter massage, you can do almost kind of a firmer kneading massage at those areas that you have that fibrosis, and then always finish with that lighter massage. So we'll go ahead and do this 2 more times, just sweeping nice, slow, gentle movements all the way up the leg, up to that groin. And you want to make sure you have fingers together, you have full hand contact on your leg. Next, for the thigh, we're going to be going from the back to the sides all the way to the front. So I'll bring my leg up so you can see it a little bit better. You can either overlap like this, or you can have one hand on top of the other. And you're going to bring that from the back all the way to the front, okay? Again, just like at the front of the thigh, you can certainly spend extra time here if you need it. A lot of people tend to pocket and have more swelling at the inside part of the leg, and so you can definitely spend more time where you need it. All the movements that we do are slow, controlled movements, fingers together, full contact of your hand on your leg. And like I mentioned earlier, this is best done skin on skin versus over your clothes. That's what's going to really get that fluid moving, get those tissues moving. And you can do that deeper kind of kneading, fibrotic work where you have fibrosis if you need it on the back or the side of your leg too. So we'll go ahead and do this massage from the back of the leg, the sides, and the front. We'll do that one more time. If you need to, go ahead, pause here, spend some extra time if you need it. Otherwise, if you've done that 5 to 8 times, then we can move down to the knee. For the knee, we're gonna do the same exact thing as we did for the thigh. We wanna work the back, sides, and front. At the back of the knee, you're going to kind of cup your fingers like this, and you're going to bring it forward. You're gonna bring that fluid towards you. So you're gonna come behind and you're going to massage it up towards you. Here behind the knee, you can give deeper pressure because we are working on some lymph nodes that sit behind the knee. After 5 to 8 times, or again, more time if you need it, if that feels good. If you have more swelling at your knee, spend extra time here. After you massage the back of the knee, we're going to massage the sides of the knee. So you're going to move it up and forward. Again, we want fingers together. We want full hand contact. Really get as much of that skin contact as you can. Help move that fluid. If you're doing this lying down, you want to make sure, if you can, that you have some pillows or a wedge pillow so that your legs are elevated. If you're doing this sitting in a chair, this point forward, it may be easier to cross your leg over. Otherwise, you just want to try to keep it as elevated as you can. So we're going to now do the top of the knee. And again, you saw me here, I had to shift forward a little bit to come and get it. But if you're in a recliner, then you can always move that recliner to help you reach your leg easier. So now after we finish the knee, we're going to be going down the lower leg. So you're going to, just like with the thigh, sweep up from the ankle, and you're moving that all the way up to the knee. And you're going to repeat that 5 to 8 times. At least, you can always do extra. Again, if you're in a position besides on the recliner, you can cross your leg over and still massage up this way. Or if you've got some pillows, you can always have your leg elevated on some pillows as well to help you reach. We've got that nice slow movement going up the front of the lower leg. We'll do that one more time. Again, if you need to, go ahead, pause where you have extra swelling, spend extra time there. And then we're going to do the calf. So you're going to sweep up and forward from the back of the calf. You're going to bring that forward. So you can either do one hand at a time, or you can sweep both up at the same time. Either way, you want to make sure that you're getting that full contact against the skin. You don't leave any areas that are not massaged because you're going to leave that fluid behind. Okay, very good. Keep working on it. Again, at least 5 to 8 times. If you have firmer tissue through here, again, you can do that kind of kneading massage and then finish up with that lighter massage. If you're able to and it feels better for you, then you can move the fluid up like this with your leg bent. It's just whatever feels most comfortable for you. So we'll do that one more time here at the back of the calf, and then we're going to start working on the ankle. So at the ankle, we're going to move it just like with the knee, we're going to move it up like that. So you can spend extra time here. A lot of people think this feels really good, especially if you have swelling at the ankles. So spend at least 5 to 8 times here. Again, pause here if you need to spend some extra time. But you want to make sure you're moving it up. You're not wanting to do it in a circle because that's just going to move it straight back down. You're not going to move it anywhere. So we want to make sure that we're moving it up from the ankle up into the leg. And then finally, after the ankle, then we're going to do the top of the foot. So you're going to just massage it up. You can even include the toes with this if you have a little bit of swelling at the toes. We're gonna do that 5 to 8 times. If you can't bend your knee up like this, you can bend forward to get to your foot, or you can bring your foot up to you, just bending your knee, or if you have some pillows to rest on, that's another way to get your ankle up towards you so you're not having to strain. All right, after that, then we're gonna get to the toes. So you're going to, if you have extra swelling at your toes and they're really puffy, you want to actually massage each toe individually. So you're just going to pump down on each toe. You're going to do that 5 to 8 times for each toe. Spend extra time if you need to on each of those toes. If you have a hard time getting each one individually, then you can just do front and back, just a general toe massage with both hands to make sure that you're getting the front and the back of the toes. Okay, or keep working each one individually. And then once we finish the toes, we're actually not done yet. So we worked all the way down. Now we need to work all the way back up. But we don't need to do 5 to 8 times. You really just need to do 2 to 3 times on the way back up. So we've got 2 to 3 times at the toes and the top of the foot. We've got 2 to 3 times at the ankle. 2 to 3 times at the calf. Again, I'm bending forward. If you have a hard time doing that, just bring your leg up to you or position yourself in a way that you can easily reach it. And then we're going 2 to 3 times up the front of the leg. And then we've got the back of the knee, doing that 2 to 3 times. We've got the sides of the knee, moving that up. We've got the top of the knee. And then we've got the back and sides of the thigh. So remember, I'll lift up my leg here so you can see we want to get the full legs. We want to get all the way from behind. Bring all of that forward. And then finally, we're going to work on the front of the thigh. Really get all that fluid out of there. 2 to 3 times here at the front of the thigh as well, up to the groin. Remember, we're moving everything up to the groin. After that, we're going to move it from the right to the left groin. So you're going to repeat that 2 to 3 times. Nice and slow movements. And then we're going to move it from the right groin up to the left armpit. Again, making sure that you go all the way from the groin to the armpit, not moving it inward. And then the very last thing that we have to do is the breathing. So go ahead and hands on your belly, right at your belly button. Go ahead, breathe in. Breathe out and press in. Breathe in. Good, breathe out through the mouth and press in. Excellent job with your MLD for the right leg. A little side note, if you find that you have to go to the bathroom and pee more after you do this massage, that's totally normal. You move that fluid out of the leg and it has to get back into the circulatory system. Some of that you just pee out. You can do manual lymphatic drainage once or twice a day and do it at a time of day that is convenient for you and that will be the most likely that you'll do it consistently. Most people do it in the evenings once their day has kind of slowed down a little bit. I hope this full routine for MLD for your right leg was helpful for you and you're feeling better. Thanks for watching, and make sure to subscribe for more videos on managing your lymphedema.